Do you frequently feel like your heart pains sometimes? Or maybe you've noticed that you're much taller than most people in your family, not just a little, but a lot. Maybe your joints bend too easily, or your eyes get tired fast when reading. These might seem like unrelated issues, but for some people, they can all be signs of a condition called Marfan Syndrome. It's not common, but if someone has it, their body's connective tissue, the stuff that holds the body together, isn't as strong as it should be. Think of it like a tent. The poles are your bones, but the ropes and fabric holding it up are like connective tissue. If those ropes are weak, the whole tent can sag or even fall. That's what can happen in Marfan syndrome, weak ropes in the body. So what causes Marfan syndrome? It comes from a tiny mistake in your genes, like a typo, in your body's instruction manual. This typo happens in a gene called FBN1, which helps your body make a protein called fibrillin 1. This protein is important for strong connective tissue. When it doesn't work right, the tissue gets stretchy and weak. Most often a child gets it from a parent, who also has it, like inheriting your mom's curly hair or your dad's laugh. But sometimes the typo happens by accident when the baby is forming, even if neither parent has it. Imagine baking a cake and accidentally using salt instead of sugar. The recipe was fine, but one wrong ingredient changes the result. Now, how do you know if someone might have Marfan syndrome? It shows up in many ways. For example, a person might be very tall and thin, with long arms and legs, like their arms stretch past their hips when standing. Fingers are often long and skinny, like a spider's legs. Some people get frequent back pain because their spine curves. That's called scoliosis. Others may feel chest pain or shortness of breath because the main blood vessel from the heart, the aorta, can stretch and weaken, which is serious, like a balloon that might burst. Eye problems are common too. Maybe they need very strong glasses because their lenses are in the wrong place. And have you ever seen someone whose chest looks sunken or pushed out? That's another clue. But not everyone has all these signs, just a few might show up. How do doctors find out if someone has Marfan syndrome? First, they ask about your body, your family, and your health, kind of like a detective collecting clues. They might measure your arm span and compare it to your height. They'll check your heart with an echo, an ultrasound of the heart. Look closely at your eyes with a special light, and maybe do a spine X-ray. Sometimes they do a genetic test, a blood test to check for the gene typo. Once diagnosed, treatment isn't about curing it but managing it. For example, if the heart's aorta is stretching, medicines like beta blockers can help slow it down, like putting less air in a weak balloon. Some people need glasses or braces for their spine. In serious cases, surgery can fix the heart or blood vessels before problems happen. Regular checkups are key. It's like servicing a car so it doesn't break down. Can we prevent Marfan syndrome? Since it's caused by genes, we can't stop it before birth. Like you can't unwrite a typo in a book already printed. However, if a family knows they carry the gene, they can talk to genetic counselors before having kids, kind of like checking the weather before a picnic. There's no way to prevent the gene change, but we can prevent serious problems. Avoiding heavy lifting or intense contact sports like football helps protect the heart and blood vessels. Staying healthy with good food, light exercise like swimming or walking, and regular doctor visits goes a long way. So while we can't prevent the condition itself, we can help people live long, safe, and happy lives with it. Scientists are working hard to understand the gene and how it affects the body. One big breakthrough is a drug called losartan, originally for blood pressure, which may help protect the aorta by reducing stress on the weak tissue. Think of it like giving extra support beams to a shaky bridge. Gene therapy is still in early stages, but researchers are exploring ways to fix the faulty gene in the future. Imagine editing out the typo in that instruction manual. Also, better imaging tools now let doctors see tiny changes in the heart earlier than ever. These advances help people get care sooner and live better. Clinical trials are ongoing, and patient groups are helping spread knowledge so no one feels alone in their journey.